Dr.
Nice to
Klein,
see
how
you.
are you? Good seeing you. How's your day going?
It's good. It was a long day, but good. How about you?
Good. Yeah, we're in the West Coast. Beautiful day.
Oh, good. I'm in Connecticut, but it was beautiful here as well.
Good. Is your
Yeah.
practice back up and running?
We're, operating kind of at, 50, 60% at this point, but it's going really well so far.
Okay.
How about you?
Good. Well, I'm not seeing patients these days, so for me, life has really not changed that much because we have a really, digital lifestyle right now.
Right.
And we traveled to the West Coast about 3 weeks ago. We wore our N95 masks and did move out of the airplane seat and made it here safely.
Oh, good. Yeah, we have not tried any airport travel yet, but hopefully soon.
Would you, so how do you feel about airport travel?
I mean, I think as long as the airplanes aren't too overpacked, that it would be okay.
Okay.
Most people I've talked to have said it's been pretty well controlled, and as long as you're wearing your mask, hopefully, everything should be okay. Our rates in Connecticut are really good right now, but I understand that on the West Coast, they're starting to spike a little bit more.
Yeah, Dallas is also, that's where our home base is, so that's beginning to spike.
Yes.
It was pretty quiet last month, really, up to last month, and then it's beginning to get heated there. So, and it's still 95 degrees, so the theory that it's going to go away with heat is
not bearing out to be true, huh?
No, not at all.
No. And in Florida, it's really going up quite a bit as well.
Yeah.
Yeah. Well,
So
hopefully everyone else
what do you do in your
safe.
personal life, in your day-to-day life? You have children, you have young children.
Yes. I have 4 children. They're ages 10 to 4, or almost 4. So it was a huge relief when school ended on last Friday. And now they're doing a variety of, outside camps for the summer. And I have my husband's working from home, so at least he's there. And I'm going into the office about 3 days a week. So it's working out well, but we're really hoping that school goes back in the fall in some capacity, because I am definitely not meant to be an elementary school teacher.
So kids are in camp now?
My 2 older boys are doing a mountain biking camp this week. So outside, small group. My 2 younger ones are scheduled to do a camp in July, like an outdoor camp as well. So not, any bigger.
Do they wear masks?
The kids do not have to wear masks. The counselors are.
Okay.
Yes.
Yeah.
And then they're getting really scrubbed down the way that we scrub down when we come home from the office each day as well, often with our clean products, right?
Yeah.
Try to just, leave the dirty shoes at the door and take our scrubs off and really cleanse. A lot of our staff is keeping an extra set of clothing at the office, so that they're not bringing anything contaminated home, and we're all just being as safe as we can be.
Right. Great.
Yeah.
So, I read your bio, and I want to start a little bit with that because you have an interesting background. You have a bioengineering degree, and then also a master's of public health, and then you went into medical school and dermatology, and now in practice, and you're also an innovator as well. So what made you decide to go into engineering?
So, applying to college, you're 17, you're not quite sure what you want to do with your life. And, I was leaning towards medical school, that early on as well. But my dad was an electrical engineer, and he, we had studied the different, options of whether to do a biology major or do something in engineering or, just a liberal arts education. And I really thought that bioengineering would really keep all my options open if I decided not to go to medical school. And the analytical way that you're, thought to think as an engineer is really quite different. And I have to say, engineering school made medical school seem easy. It was a good preparation for medical school because it was definitely a very hard way to get to medical school.
And you went to University of Pennsylvania, which is a, top tier, medical school. So when you said that was Engineering was harder in medical school. That's good. Yeah.
Yes, I was at Penn for both engineering and medical school. I took a couple years out in between. I wasn't quite sure if I was definitely going to go to medical school or do something more in industry. I decided to get my master's of public health just to see more of the clinical side and the epidemiology aspect of medicine. And I really think that the combination of bioengineering and the epidemiology background really helped to frame my medical school curriculum differently than many of my peers. And it has helped with, clinical trials. And, it's not, at one point back in the day, I did some basic science research as well. And just having that background was very useful.
Right. So you go to Penn, and then you did your residency at Yale.
Mm-hmm.
And then you were on the faculty there for a number of years.
Yes, I stayed on faculty at Yale and was seeing patients and teaching residents, and I'm still on the voluntary faculty there. And then I also run the dermatology curriculum at Quinnipiac, which is one of our local medical schools. And then I was in private practice for a few years before starting my own practice 2 years ago with another dermatologist, Dr. Robinson.
Great. So that's a really good background. It took you a number of years to get to where you are and be a star in your field.
Oh, you're sweet.
Yeah. So let's talk about all the things that are going on with the masks and maskne, and you see a lot of that and things heating up. So go over some of the problems that people are seeing with the face, and especially with nurses, I guess.
Even personally at our office, we're dealing with it because we're in N95 masks for, 10 to 12 hours a day. And it creates a lot of congestion for the pores. It's also extremely drying. You come home, your lips are oily as well as chapping. So it's a hard combination. And we have to treat it with both, products that dry you out, which is most of the acne products, that are going to clean the pores, as well as treating it with emollients to really moisturize the skin. So it's a combination problem. And, we would never normally treat acne with Aquaphor, some of these other very thick moisturizers, but sometimes patients are coming in so red and raw from the masks that we have to combine our acne treatments with very thick emollients. So it's a challenging problem. We often recommend your Clean Acne facial wash is a great one, very low concentration of salicylic acid, so not too drying. And the sodium hypochlorite is obviously, has great antibacterial properties. And then I'll often have my acne prone patients use a thicker emollient, either the Clean Moisturizer or something like Avene Sickle Fate is a great product that doesn't clog the pores too much.
Okay, good. And does this ever lead to really deeper breakdown or cellulitis or?
We have seen some cases of impetigo. So just a, superficial bacterial infection, usually caused by Staph aureus. Sometimes some other, bacteria can also cause it. And Staph loves to live in warm areas, so particularly the nose or other orifices. So in those cases, if a topical antibiotic, as well as cleansers aren't solving the problem, then we will add on oral antibiotics as well. But we often will do that with acne anyway. We don't do long courses of antibiotics anymore in our practice. We really are trying to be conscious of the, just population health and not using and overusing antibiotics. But short courses of antibiotics are used both for maskne as well as for regular acne at times.
What is a short course? How long is that?
I try to limit it to a month or two, which is still a long time for acne. But, in the grand scheme of things, we used to use antibiotics, for a year or two, and there's still probably some practitioners who do. But we try not to do that.
So is that now AAD standard to minimize to 1 to 2 months?
That's not an AAD standard.
Right.
I just think that with a really good topical regimen using, as well as some vitamin supplements. We can do in-office procedures such as light treatments, facials, laser treatments, as well as other oral medications such as, vitamin supplements like niacinamide is a great one. Hormonal medications for females work wonderfully for acne. And then we use a lot of isotretinoin or Accutane for our patients as well. And I think that, you have to weigh the risks and benefits of those medications, but often, trying to get patients off of antibiotics is good for overall stewardship.
Yeah, so that's going to have a huge impact on industry. I mean, because a lot of the industry is focused on dermatologists using antibiotics,
Most of the antibiotics we use are generic.
Yeah.
There are a few that get introduced every couple years. We really try to be cost conscious as well. A lot of patients have very high deductible health plans at this point. So, we have to be conscious of that.
Right. Okay. Very good. And then what about around the nose? Are there anything particular that you see? Is there more problems with rosacea, et cetera?
Yes. So there's a component of rosacea called perioral dermatitis. It's kind of a mix of the redness of rosacea as well as a little bit of irritation and itchiness. So it has a dermatitis component or inflammation of the skin. Often it's caused by products, exposure, sometimes inhaled steroids. This time of year with a lot of allergies going around, people are using a lot of Flonase and other inhaled steroids. But also the masks are causing more of this periorificial dermatitis. And so using the antibacterial cleansers can be really helpful, sulfa washes, and then very free and clear products. Either the clean line is obviously great. There's also another line of products called Vanacream or free and clear. And those are wonderful. And then we'll use anti-inflammatory medications. Interestingly, topical steroids can make perioral dermatitis worse. So we try to stick with topical Tacrolimus or Pimicrolimus and other, topical antibiotics and sometimes a course of oral antibiotics.
So go over a little bit about Tacrolimus, the mechanism, and that's obviously a prescription drug.
Yes. So oral Tacrolimus is used as a chemotherapeutic agent. Using it topically, it's a great steroid-sparing agent. It inhibits the interleukin, some of the inflammatory cascades, and, can decrease redness. It really helps with atopic dermatitis and other inflammatory conditions of the skin. And the nice part about it is that you don't have to worry about thinning the skin, causing broken blood vessels, or some of the other long-term effects of topical or systemic corticosteroids.
Did they do they have a black box warning?
They do. There was some mice studies a long time ago looking at topical Elidel and Protopic, and they did find that when you had high levels of absorption, there was a slight increased risk of lymphoma. These studies have been repeated in both children and adults, and they have not, when used on small surface areas, been seen to have an increased risk of malignancies, but it is something that we discuss with our patients.
So the malignancy was seen in mice, not in humans?
Not in humans.
Right. And what percentage of dermatologists do you think that kind of like ignore the black box warning?
I think most of us do. I think that most of us have, there have been, most studies after have really, have seen that that's not true. And, there even used to be a warning not to use in young children. Right. And I think most pediatric dermatologists are very comfortable.
Right. So go over black box warning for the audience. They may not be familiar with that. Black box warning.
Yes. So basically, if there's any risk factor that's determined in a study, it's of a significant, quantity, then it has to be on the label. So if you watch commercials and they go into any detail on a medication, it will then be followed by a million side effects that medication can cause. And it is the company's responsibility, unfortunately, or fortunately for the consumer, to list all of those small side effects. Nowadays, with Google and online, research, most people are able to, find every little side effect that a medication has ever caused. So as physicians, it is our responsibility to counsel patients on these side effects, but, in general, we go over the more common ones, because most of the time, most medications can cause different side effects.
Right. That's great perspective. Thank you. So on issues of the face and mask need, do you see anything particular for men that they should be aware of or that you're seeing more of?
Absolutely. So, masks do not fit well when people have a lot of facial hair. So many healthcare providers are being forced, to shave on a more regular basis than they may have before. And there's a condition called folliculitis, which is an inflammation of the hair follicle. And it often is caused by either shaving or when we see it on the body, often it's from chafing. But, with mask knee, we are seeing increased amounts of folliculitis from people shaving more often. A lot of our personal care salons have also been closed. So, some people who may be waxing or doing laser hair removal or other treatments to get rid of hair are forced to shave right now. And, these fancy razors that all have, 5 different blades cut the hairs in all different directions. And over time, it can sometimes cause the hairs to grow onto themselves and cause more inflammation. And then bacteria and secondary inflammation can result. And this can cause red, inflamed skin, as well as little bumps and sometimes even pustules or little fluid-filled bumps that can be filled with either neutrophils, which is an inflammatory cell, or different bacteria.
Very good. Okay, so since we're talking about folliculitis, an area that comes up often, it's hard to treat, is hot tub folliculitis. So why don't you go over that and explain the pathophysiology and people are getting into hot tubs and by the way, somebody asks, do you recommend a single blade or?
Yeah, so I do, for patients who are prone to folliculitis, I do like a single blade razor. I do recommend for people to, really shave after they're in the shower so that the hairs are loosened a little bit. I also like those shower poofs, just to use them in the shower in a circular motion, either with like the clean body wash or facial wash, which is nice and anti-inflammatory and helps with the folliculitis, or a benzoyl peroxide wash can also be helpful to decrease bacterial overgrowth. And using a single blade razor in the direction of the hairs can actually, it won't give you as clean of a shave, but it'll decrease the folliculitis and help the hairs start to all grow in the same direction. So even those just like cheap, Bic razors that you use once and toss, those are going to help you get over your folliculitis quicker.
Okay. All right. Folliculitis, let's go over that.
Yeah, to hot tub folliculitis. So we're seeing a lot of hot tub folliculitis. Generally, this is in a bathing suit distribution. So it's very important, when you get out of a hot tub, to shower with a good antibacterial cleanser. You want to make sure that, you're adequately treating a hot tub, checking the pH, checking for bacterial overgrowth. But when we see, hot tub folliculitis, it's generally from a bacteria called Pseudomonas aeruginosa, which can withstand the high heat of a hot tub. And commonly, it's at the beginning of the season if the hot tub isn't treated appropriately or if it's neglected throughout the season. And it presents with little bumps that can be quite painful or itchy, as well as pustules. And people can see it, commonly recurring every time they go in the hot tub. And if it's not treated appropriately, it can become a chronic, long-standing condition. But when we recognize it, it is actually quite simple to treat with a good antibacterial cleanser, as well as either topical or oral antibiotics that are aimed at this gram-negative bacteria.
Do you culture it? Do you culture folliculitis?
It depends. Frequently, or at least recently, given COVID, we're doing some of these visits virtually. So obviously then we're not able to culture it. But if they're in the office and there's a good pustule, I will culture it.
Okay.
Often it'll grow Pseudomonas. Sometimes it'll be a mixed flora, sometimes with some staph in there as well, which may be the result of secondary impetiginization or just secondary infection, because we all have staph on our body. And then when you have, you know, an impaired surface, you can get this secondary overgrowth of staph. I should say most of us have staph on our body, not all of us, but most healthcare workers are colonized with some degree of bacteria. When it becomes, you know, when it starts causing infections or skin rashes is when we, you know, treat it.
So why does it recur when you get back in the tub?
Because the bacteria is still there if it's a hot tub that's inadequately treated.
And does the heat just make the Pseudomonas grow more? Or?
The Pseudomonas likes heat, so it can withstand the heat. And if the pH is off, then it can, you know, really flourish. So often you hear about people who are going on vacation, they come back with Pseudomonas.
So you want to be at a high quality place or really check the records of the pool maintenance.
Yes. But you just also have to always remember to rinse off when you get out of the shower, out of the pool for this reason.
Right.
Yes.
Right.
And, you know, if you're going in, you know, a hot tub that you're not sure of, then make sure you use their antibacterial cleanser, take your bathing suit off.
Right.
Does using the so someone just asked if using the Salicylic Acid facial cleanser on the Bikini line helps with shaving bumps. I think it does. You know, it has a great exfoliating property. And then the clean one obviously has that dilute, you know, hypochloric acid in it as well, which can be helpful. Don't you think?
Yeah, I think so. We have run into questions from customers with, you know, long-standing folliculitis that they just can't seem to knock out. I say, you know, go see your board-certified dermatologist. Let them get to the basics.
Yes.
A lot of times people skip steps and then it becomes chronic if it's not really treated properly.
Yes. You know, some people, even despite all of these interventions, you know, still really flare. And, you know, at that point, I do recommend either, you know, waxing or laser hair removal, really, you know, going to the root of the problem, which is the hair follicle. And if you can eliminate the hair follicle, it solves the folliculitis. So that's more of a permanent.
For laser, the waxing is painful.
Exactly. Yes. You know, over the summertime, we try to decrease some of the hair laser because it can cause significant dyspigmentation if you go into the sun afterwards. And we certainly don't treat if anyone has a tan of any sort. You know, for the fall, definitely starting laser hair removal, if you're a chronic folliculitis sufferer, makes a huge difference. Yeah.
And what antibiotic do you use? And it's oral, right? I mean, for the Pseudomonas folliculitis?
Yeah, I usually do Augmentin, especially this time of year. It's not photosensitizing, so it's an easy one to use. If it's just a very small area that's affected, I'll sometimes start with a topical, like a clindamycin lotion, or even some upiricin ointment, as well as, you know, either a Hibiclens or a chlorhexidine or the clean wash.
Okay.
And then I think someone's asking about rosacea tips.
Yeah.
If you think that we've covered folliculitis.
Okay. I think we've covered it. What happens with folliculitis if somebody's showing up to you, something that's lasted a year? I'll tell you a case. 40-year-old marathoner, every time she runs and trains more, she gets more of it.
Right. So, you know, a lot of times in athletes, you know, they're wearing very tight clothing for long periods of time. So taking off spandex right after you work out, using, you know, a chafing product to decrease some of the chafing can be helpful as well. But it is tough in athletes, but using, you know, regular antibacterials and then switching to, you know, more breathable fabrics can be very helpful.
Does the activity or heat have much to do with that, with the recurrence?
Absolutely. You know, any moist, warm area is going to be more prone to folliculitis.
Okay.
And, you know, similar to, you know, the mask acne that we're seeing, you know, for athletes that are wearing helmets or lacrosse players, you know, those are areas wherever there's an area of friction, you're going to see more breakouts.
Yeah. All right, very good. So you want to cover that rosacea?
Yes.
I think we've had enough folliculitis, and they can
Yes, for sure.
you or contact your office for more.
Absolutely. We're doing virtual visits if people are challenged with that.
How do they get a hold of you for virtual visits?
They can email our office. It's info@moderndermct.com, or just go to our website, moderndermct.com, and there will be a link there.
Okay. And are you on Doxy as well?
We are not on Doxy. We are using either Zoom or FaceTime, or we have a lot of different ways that we can do a virtual visit.
Okay. Okay.
Yeah.
All right. Take the rosacea question.
Yeah. So, summer, wine, spicy foods, those are all triggers of rosacea. So we're seeing a lot of quarantine flares of rosacea. Also, we know that sweet foods, high carb diets can all flare rosacea as well. But certainly in the summer and the springtime, sun is a huge factor. So making sure that you're using really good SPF. I like mainly physical blockers. So ones that are, physically blocking the sun, zinc and titanium based compounds are best. We also find that iron oxide based sunscreens can be very helpful. The wavelength that those block can be particularly beneficial for rosacea sufferers. So making sure that you're reapplying your sunscreen every, 2 to 3 hours. And then, a hat, sunglasses, all the physical blockers that you can wear are also really important. And then we use a lot of topical products. So, Azelaic Acid can be a great anti-inflammatory, anti-redness product for rosacea. We use topical antibiotics such as metronidazole. And then sometimes back to those topical calcineurin inhibitors, like Tacrolimus can be used for more of the inflammatory rosacea, as well as oral medications can be used.
You said azelaic acid?
Azelaic acid, yes. The brand name of that medication is Phenacia.
Okay.
It works both through some melanin pathways. So, rosacea, it's dilation of the blood vessels and the telangiectatic type. But often also, the sun can trigger the melanin pathways, the pigmentary ones. And azelaic acid blocks both of those pathways to decrease redness and dyspigmentation.
Okay. And high carb meals worsens rosacea?
Can definitely, we've studied it more with acne, but papulopustular rosacea, has some of the same pathophysiology as acne. So we have found that high carb, high sugar diets can make that worse. Okay. And wine and alcohol, has been studied extensively. So basically this quarantine diet is leading to a lot of flares of rosacea.
Okay. All right. Well, I didn't know that. We'll have to recommend a lower carb diet, which is good for your heart anyway. You don't want
exactly.
Because anything with high carb, the insulin level goes up, and
well, it's just that high carbs get turned into sugars is really the premise of it.
Yeah. Very good. Excellent. All right, and then the folliculitis that you're talking about, is that front, back, or are there any certain body parts that the folliculitis is harder to manage than other areas?
I think it can be challenging depending on the person. Some people with long hair find that they're getting more acne folliculitis on the upper back. Athletes, sometimes it's on the back side or the thighs. And then, a lot of men get it in the beard area. The pseudofolliculitis barbae is a component as well, depending on the type of, hair that's involved. So, we treat them all similarly, but also a little bit differently depending on the exacerbating factors.
Right. What about other conditions associated with high insulin, like HS? Are you seeing more of that in the summer?
Yes, HS or Hidradenitis Suppurativa, which is in this follicular occlusion triad or tetrad, depending on how you look at it. Again, it's a problem with the hair follicle. Essentially, can certainly flare with heat. So I have at times treated it with agents that decrease sweating. So there's something called glycopyrrolate that's available both in a topical and an oral form. So if there's a big component of sweat that's exacerbating the hidradenitis, then you can try to target sometimes the sweat glands. But more so, you know, these days we're treating it with biologics, TNF alphas and other immunomodulatory medications that can really shut down that inflammatory cascade.
Okay.
And then, you know, weight loss can be very significant in overweight patients who are sufferers of hidradenitis.
Okay. Okay. Now let's switch topics a little bit. You're also an innovator. You've developed some products. So tell us what you've developed and why and how's it going?
Yes. So along with my work partner, we've developed a clean skincare line called Pure Bioderm. So far, we have two products, an amazing antioxidant serum that has vitamin C, fluoretin, ferulic acid, and some other brighteners. That's fantastic for the morning because in the morning time, you really want to prevent damage from free radicals and sun. So great to use in the morning with your sunscreen. And then we have a B5 hydrating serum that also has an apple phenone in it for brightening. So that can be used, you know, both morning and night as both an emollient as well as a brightener. And it's going really well. We sell it in the office as well as on Amazon. It's all sourced and produced in the US, in Pennsylvania, actually. So luckily, you know, COVID has not affected our distribution at all. And we're hoping, you know, in the near future, once we regroup from COVID, to have a few more products.
Oh, good, good.
Yeah.
How long did it take you to develop that?
It took about 6 to 12 months to develop the first product. And then the second one we had in the pipeline. So it was a little bit quicker once we learned all the nuances. But I would definitely love to get your advice on that since you're a few years ahead of us and I'm sure have worked out many of the kinks that we are still learning.
Yeah, you need a good supply chain person that
Yes.
we have, and that's a real science, a real engineering feat, really, of organization.
Yes, and
so we can talk offline about that.
Yes.
Congratulations.
Absolutely.
It's not
Thank
easy
you.
to do, you know, bring out products and, you know, it's
Yes.
good. And my wife
Yes.
will want some, I'm sure.
Oh, yes. We can send her some for sure.
Good.
Yes.
Good. She'll work out a trade with you. Yeah,
Perfect.
all right.
Good.
And so as far as your practice, it's fairly new. And I noticed in your social media, you all have a lot of kids.
Yes. We
between
do.
the
We
two of
each
you,
have,
how many? You have 7?
we each have 4 kids.
Oh, 8. Okay.
We have 8 for the 2 of us. Yes. But we do actually, we have a new doctor that's joining us in the fall and he only has 1 kid so far.
Ah.
So he has a lot of pressure.
Yeah.
But he's straight out of residency. So he's still a lot younger than us. So he has time.
Yeah. And plus, you know, he's a male. He's kind of not as strong.
Exactly.
Yeah,
but his wife's awesome. So she
Right.
knows.
We've got Romine on. She's on our board of directors and MAB. She has 4 children and a very busy
Yes.
business and
Yes.
you know, gets a lot done. So kudos to you.
Yes.
Listen, I've really enjoyed having you
Me too.
on the call, and I'm glad Connecticut is safe and comfortable, and your kids are safe. And
You as well. Thank you so much for having me, and we look forward to working with you in the future.
likewise, yeah. Thank you, Rhonda.
Have a good night.
Good night. Bye bye.